Representative Berg and Representative Robbins. The chair moves House File 2371 before the committee to be referred to the Public Safety, Finance, and Policy Committee. Who wants to introduce it? Go ahead, Representative Robbins, to the bill.
Thank you, Mr. Chair and members. Thank you very much for hearing this bill. We are working under my version of the bill, which is HF2371, but Representative Berg has HF1584. They're very similar, so we appreciate you hearing from both of us co-presenting today. Members, this is a bill I've been carrying since my freshman term, and this is the first time it's had a hearing. And so I am very grateful to the committee for hearing the bill. It's a very simple bill. It would require that patients give consent before undergoing anesthetized procedures under which they could have a pelvic or prostate exam performed on them by students who are learning how to be physicians. And this is, I think, a very common sense bill. When I first learned that this was even an issue, I was stunned. This issue actually came to my attention by a friend of mine in another state who went through cancer treatment. And in her cancer treatment support group, this was the hot topic back in 2019. That's how long this has been an issue, and predating that. And so I drafted a bill, worked with some other advocates, and generally was told this doesn't happen, don't worry about it. Maybe people were trained like that in the old days, we don't do that anymore, which may be all great. But if that's true, then let's just put it in law, best practices. When I first worked on this, members, there were 8 states that had passed these sensitive exam laws. Now there have been 25. This is commonplace around the country now that states are protecting patients, and it's very common sense. If you're awake and there's a student present, they ask for your consent for the student to be in the room, to observe the exam, let alone perform the exam. So if you are unconscious, whether because of an accident or because, in most cases, a medical procedure, you should have to be requested to give permission in that case as well. So it's a simple bill. I think it has broad bipartisan support, as you'll see before us. And I do want to point out that Chair Liebling reached out to us over the weekend with some technical changes that she would like to see, and we weren't able to get that processed in time for this hearing, but we have committed to Chair Liebling that we will work with her and work on that for the next stop. So thank you for bringing those concerns forward. So could I invite
Representative Berg, did you want to go ahead, please, Representative Berg?
Thank you so much. Representative Robbins gave a great overview of the bill. I also carried legislation like this last biennium and did not get a hearing on it. So what I just want to say is that the right to give consent for what does or does not happen to our bodies is each and every one of us birthright. And so this bill, in the context that we're discussing, goes a long way to protect that sacred right. And I really appreciate all the work you've done for longer than I've been here to shed light on this issue and to make progress. Thank you, Chair.
Thank you, Representatives. We are now going to testifier, and we have one on Zoom right now that signed up, Molly
Yes.
Montague or Montague, thank you.
Montague, thank you, Mr. Chair.
Well, yeah, thank you. Go ahead. We would ask to keep it to about 3 minutes, please.
Understood. Thank you, Mr. Chair and members of the committee. I am Molly Montague. I am the Director of State Legislative Affairs with the Rape, Abuse, and Incest National Network, better known as RAIN. We are the nation's largest anti-sexual violence organization, and we run the National Sexual Assault Hotline. And I'm here today to urge you to support HF 2371, which addresses an issue brought to our attention at RAIN through folks calling the National Sexual Assault Hotline. Let's say that you go to a hospital for a shoulder surgery. And while you're under anesthesia for that procedure, students are brought in to practice a rectal, prostate, or gynecological exam on you. You'd probably expect to know that they're going to do that. However, someone could conduct a practice, non-medically necessary pelvic exam while you are under for your shoulder surgery, and you wouldn't necessarily know it. While likely uncommon, these practice exams, unrelated to the procedure that the patient went in for, do happen without the explicit permission of the patient. That is because in Minnesota, there is no law for the students or physicians to lean on if asked to conduct these educational exams without a patient's consent. Most physicians and students want to build a relationship of communication, trust, and consent with their patients. Requiring patients to give explicit, informed consent prior to these educational exams protects future medical professionals and patients, especially for survivors of sexual assault. Waking up from a procedure to find they have been violated elsewhere in their body is extremely re-traumatizing and causes some to avoid future medical care. 26 states have a law requiring explicit informed consent, including Ohio, which passed a similar law last year, Missouri, Maryland, and Pennsylvania. The American College of Obstetricians and Gynecologists and the American Medical Association Code of Medical Ethics support informed consent practices for unconscious practice exams. This simple policy will give medical students and those who train them the support of the law when seeking consent before educational pelvic exams and ensure that medical interactions are transparent and safe for patients. As such, I urge this committee to support HF 2371, and I thank both the sponsors for working so diligently on this issue.
Okay, thank you. Appreciate that. Open up to public. Anybody in the audience that would like to testify on the bill? Okay, seeing none, we have Representative Carroll. You have a question.
Thank you, Chair. This is to the author. I appreciate you bringing this bill, bringing this bill to us. I was wondering, why isn't the provider's professional obligation enough?
Representative Robbins? Okay.
So my understanding is that because it's in a clinical setting and people are participating in having the student present, that there's a sense that there's a general consent for student participation. And that, I think, was more the standard, but clearly times have evolved, and we think that providing informed consent is the best standard of care, and that has been upheld by the Association of Obstetricians and Gynecologists, the Minnesota, or the Medical Association. I have a list of the different professional associations that now support informed consent here. So it's the American College of Obstetricians and Gynecologists, the American Medical Association, and the Federation of State Medical Boards all say that now this is a standard. And in 2024, the U.S. Department of Health and Human Services issued a memorandum suggesting that every state should adopt a policy like this, but it wasn't like force of law or something. So we just feel like this is best practice, and Minnesota's a leader in healthcare in all sorts of areas, and we certainly should be a leader in making informed consent for sensitive exams a standard practice.
Thank you. And Chair?
Follow up there, Representative Carroll?
Yes, quickly. So what I appreciate that response, but what I'm looking at is, why isn't the professional obligation of the provider enough to cover this situation? And I'm in support of what you're doing, but I'm just kind of surprised that we can't rely on their professional obligation to not do this.
Right, I appreciate that, and perhaps it would cover it, Mr. Chair, but the fact is it doesn't seem to have stopped the practice. So since the medical ethical obligation has not stop this from happening. As you'll see in the study, I put in a study in your packets, members, from, I believe it's 2022 or 2023. This isn't something from like the 60s or the 70s. This is ongoing concern. And a lot of times the concern is expressed by medical students. I have to tell you, 2 years ago, I wasn't going to reintroduce this bill because I tried so many times and I was just getting nowhere. And medical students are the ones who reached out to me and asked me to reintroduce the bill because they are put in an uncomfortable position where they are asked to do something by a supervisor that they don't feel comfortable doing because they know consent wasn't granted by the patient. And so I'm hearing that from patients, but I'm also hearing it from medical students. And so whatever the broad ethical obligation is in the oath certainly hasn't covered this topic sufficiently, so that's why we're bringing the bill.
Okay.
One clarification.
Representative Carroll.
Quickly. So you say medical students, do you mean residents, or do you mean those who haven't graduated from med school yet?
Representative Robbins.
You know, I would have to go back and look through my emails. My understanding is I think they were mostly residents, but I mean, it was a couple years ago, so I don't have that top of mind of what level of student they were.
Thank you. Thank you, Chair.
Okay, Representative Hewitt.
Thank you, Mr. Chair, and thank you, Representative Berg and Robbins, for carrying this bill. This is a really important bill, I believe. I'm just curious, does this go far enough? I'm real concerned that we're not, to get that informed consent, we're not explaining the whole procedure of what's going to happen, what they plan to do. It draws back a memory of mine to the gymnastic team in the U.S. Olympics. How can we avoid that kind of situation when the patient really probably doesn't understand what's being done? Is the bill go there, or can it go there? Thank you.
Representative Berg or Representative Robbins?
Yeah, go ahead.
Thank you, Mr. Chair, and thank you, Representative Hewitt. I mean, I think both through the Representative Carroll's question and your own, like, why do we have to talk about consent in this day and age? This bill specifically works within the context of medical students. The bill that I had that was similar was just consent in general from any patient, that when you go in for hand surgery, you don't get a pelvic exam that you didn't consent to. And so I don't know that we have an actual answer of does this go far enough, because we are seeing situations that one wouldn't imagine we would have to even consider where this is happening. But I think by and large, if you go in and you have a conversation with your provider and saying, okay, I'm going to have surgery on my hand, my expectation is that I am not going to have anything else touched or worked on while I'm under anesthesia. And I don't think that, I mean, we certainly could say you have to explain what a pelvic exam is, for example, but I think just having it as part of the form that you have to fill out, where I do consent to an exam for educational purposes or I don't. And I like the fact that Representative Robbins' bill also includes prostate exams, because I think a lot of times it's easy for us to think about a pelvic exam, but I like the scope of your bill, including those protections for everyone.
Okay, Representative Liebling.
Thank you, Mr. Chair, and thank you for bringing this. I am totally with you on the underlying issue, but there's a huge ick factor to this that is just undeniable, especially for women, but probably for everyone, really. But because this bill, and this is where I thought Representative Carroll was going to go, this actually imposes a criminal penalty. And when you're doing that, and when you're going to put structures around medical practice, especially when there's a criminal penalty, you have to be extraordinarily careful about how you word this so that you don't end up infringing on appropriate medical care. So I did make some, and thank you for mentioning it, Representative Robbins, I sent you some very specific suggestions for amendment, and I really hope that you'll take those to heart, because as the bill is written right now, and I know this is probably not the intent, but as this bill is written, a patient could not consent, would not be allowed to consent to an educational exam while under anesthesia. If you just look at the first clause here, sub 2, the first exception says that you have to have the written consent, and the exam has to be necessary for preventive, diagnostic, or treatment purposes. So I think what we're talking about here, and we have to be very careful, I think what we're all trying to prevent is exams that are not for clinical purposes, that are done without consent, right? Not for clinical purposes. And that is really not how this is drafted. So we have to be very careful. There's So with the hand surgery example that Representative Berg just brought up, say you're having hand surgery and suddenly the surgeon notices that you have vaginal bleeding. You want that surgeon to be able to do whatever they think they need to do to deal with your vaginal bleeding, notwithstanding that you didn't give consent for that exam. So that would be an example of a clinically appropriate exam. It wouldn't necessarily be necessary, because the word necessary is carrying too much weight here. Who knows if it's necessary until afterwards, right? You don't know. So you want to give doctors the ability to do what they need, what they think they need to do for the patient in the situations they find themselves, whether or not there's been written consent to that specific thing. So this just gives you a flavor of why I think this is a really, as it's written, it's very problematic. I completely get, I think, where you're trying to go, to stop these educational exams and make it super clear that that's not okay without the patient's consent. We all get that. But anything that, you know, when you start making doctors worry that they're going to perhaps be charged criminally for something, my understanding is they stop doing that thing even if it would help the patient, because we don't want doctors to worry about somebody prosecuting them for doing what they think they need to do to help the patient. So that's where my concern is, and I really appreciate your attention to that. And I just think this bill really does need quite a bit of fine-tuning before it's really ready to become law. Thank you.
Okay. I'm going to do the final question, and I'll let you address that in your closing, so, because we have a tight. So our final question will be from Representative Bonner.
Thank you, Mr. Chair, and thank you to the authors. I will say, in general, I appreciate the intent of this bill, and I understand it. And having been the victim of sexual assault earlier in life, and only recently, decades later, being able to acknowledge that, I really appreciate the understanding behind this bill. The one thing I would say is that I have been exploring this very topic as part of a larger bill of sort of patients' Bill of Rights. And one of the things that I hear often, too, is that we are not doing a good job of informed consent, even when a patient is not under anesthesia. Where someone goes in for a regular gynecological exam, for example, and then they're being asked to do a very invasive, very painful biopsy of their intrauterine lining, with no offer of pain management, with no offer or with no discussion about consent. And before you know it, a patient is doubled over in pain and unable to leave the exam room office without any guidance up front. And so while I appreciate this bill and I support the intent of this bill, I do hope that we will work to look at the language and maybe broaden the scope of this to include consent a little wider, and also at some places narrow the definitions in this bill so we don't catch doctors unaware as well. Thank you.
Okay, so you two get to please close on your bill.
Thank you, Mr. Chair and members. I do want to comment, it's funny, I'm 51 years old and I got a new gynecologist. And for the first time, even having 2 kids, all the things, all the years, for the first time, every step of the way she said, "May I?" and then fill in the blank for what, and I was like, well, lady, that's why I'm here, right? But like, that was the very first time that I experienced somebody that said, "May I do this?" every step of the way. And so thank you for your line of questioning and for sharing your story behind it. And so I am open to the things that Chair Liebling and others have brought up in terms of refining language to really get to the goal of this, which is protecting people who can't protect themselves in the moment. So I am committed to that and to working with Chair Robbins.
Chair Robbins.
Thank you, Mr. Chair, and thank you to all the questioners. And to just quickly address the concerns that Chair Liebling raised, I would point out that in sub 3, when the person is already unconscious or incapable, then if there's the need for a sensitive exam, it's necessary for diagnostic or treatment purposes, It is allowed, and in an earlier version, we had medically necessary. So I do plan to come up with the language that would address Chair Liebling's concern, because if someone is either brought in unconscious and they can't consent prior to a procedure, or if during a procedure something happens where it's medically necessary, of course, we want to provide doctors that flexibility. But I do think, I mean, it is a criminal charge, but it's a gross misdemeanor. It's the very lowest level, and I think we could maybe look at penalties when we're at the Judiciary Committee, but I would suggest that that's kind of what's been standard in the other states that have adopted this informed consent law, and so I think it hasn't caused a lot of concern in those states where, and to my knowledge, it's not been used widely, but I can try and get that data before we go into Judiciary Committee. So members, I appreciate your attention to this issue. After, I think this is my year 6 working on this, I'm optimistic that we are going to join the other states that have taken this approach. Thank you, members.
Okay, members, thank you. The chair renews his motion that House File 2371 be re-referred to public safety. All those in favor say aye. Aye. All those opposed say nay. The motion prevails, and House File 2371 is re-referred to the public safety.